Good morning, everyone. I hope everybody can hear me. Welcome, and thank you for coming this morning. We were just chatting kind of behind the scenes and wanted to kind of keep our fingers crossed that people didn't forget that it's actually Tuesday so that they jump on this call this morning because we've got some fun, exciting things to talk about. I hope everybody had a great Memorial Day and remembered what Memorial Day is all about. Besides barbecuing and being outside, although that was great. This morning, as part of our Zoominar series, is what I'm calling it, we have some guests from Mount Carmel Health Partners, and we're excited to have them. I think they've got some very, very pertinent and relevant information for our members and our group here. This series is running every Tuesday and Thursday. Some of them are at 10 in the morning, some of them are at 1 o'clock. But if you can't jump on a call or a video call, you can always catch these through our website, which is, of course, gcchamber.org, or you can get on any of our social media pages or our YouTube page and catch up with all of these as well, at least the ones that I remembered to click record for.
Camera.
So with that, I want to introduce Beth Syracuse, who is the Director of Employer Services for Mount Carmel Health Partners, and she will introduce Dr. Wendorf to us. But with that, I welcome you both, and thank you for being here this morning.
Oh, thank you very much. I appreciate the kind introduction. So I'm Beth Syracuse, and I am the Director of Employer Services for Mount Carmel Health Partners. And I'm joined by Dr. Wendorf, who's our president and CEO. My division with Mount Carmel is responsible for working with employers to provide a safe work environment through our occupational clinics, which offer pre-employment screenings, our fit for work physicals and custom services. We also offer a full suite of wellness programs, which address the physical, the mental, and the social and financial aspects of your employees. We also do biometric screenings, flu shots, lunch and learns, and very population-specific programming. We offer executive exams and wellness programs. And as a healthcare system, we're really uniquely positioned to partner with your selected insurance provider to offer access to our clinically integrated network and really manage that healthcare spend for you. Funny story, last November, we were approached by Bob Lormer to be the medical director for the Arnold Sport Festival. And it started out that we were going to be the mat side assistants for the athletes. And it quickly turned us into developing and implementing a screening process for a very little known bug called COVID-19. We were able to stand that up and successfully screen over 20,000 athletes in a 3-day period. As a result of us developing that screening process, we developed a screening process for all of our area first responders. We have the direct contracts with many cities and municipalities for their fire departments and police departments. And we were really able to get that process streamlined and scalable before the public really even became aware of the need for a screening process. As a result of that, we worked closely with Ohio Health and Ohio State to stand up the field hospital at the convention center, which is still standing, and it really looks like we are not going to have to open that up, which is a good thing. We are now, faced with the whole reopening, and we're kind of on the top of that hill with everybody really coming back to work right now. We served as a medical director for AEP, and we provide different services for cities, state, CODA, and various manufacturing companies that are considered essential, so they never actually shut down. In a lot of the conversations that we had with those business leaders, our team found that there was a real gap with the business leaders having that subject matter expert on staff. And so we decided to fill that need by making sure we got Dr. Wendorf and a couple other of our physicians that direct contact with the business leaders just to consult and figure out what are our next steps. We also found that providing that provide clear, concise, and actionable information for the business leaders. I'm going to kind of turn this over to Dr. Wendorf so he can explain a little bit about some of the things that he's seen. And then what I'd like to do is just kind of open it up to questions if you have anything that's burning. And if you don't, we've gathered a lot of questions from the different series and interviews that we've done with business leaders to figure out what it is to best help them. We found that, you know, as a business leader, you were quickly pulled out of your day-to-day business and all of a sudden faced with becoming your own private focused medical director for your organization, and also having to allocate resources such as funds and your supply chain to finding items that aren't necessarily part of your core business, but of course going forward will be part of it. And that includes little things like hand sanitizers, masks, thermometers. And then it was what kind of things do I need to have my employees do before they get to work? What should I have them do when they are at work? And then what happens when they do fall ill? How do we handle that? So Dr. Windorf, take it
Thanks,
away.
Beth. So as Beth mentioned, you know, her employer services area has had the capability of doing a lot of the wellness stuff for a long time. But as we went down this path with COVID, actually the Mount Carmel Board of Directors, many of who are business leaders, really asked the new CEO, you know, how can we help businesses get up and running safely? Because one of our core tenets at Mount Carmel is care of the community. And we saw a lot of businesses getting ready to open and sort of wondering exactly what were they supposed to do? What were they supposed to not do? So we decided to talk to Beth's team and say, you know, can we stand up something that would be sort of a one-stop shop, a place that a business owner wouldn't have to, you know, go through the CDC website, go through the World Health Organization, you know, go through the ohio.gov website and just go through all of that information and just try to figure it out for themselves. We could put everything in one place and we could provide some service to the businesses to say, you know, if you have a question, we're here to answer it. We can be your consultant for this. And so we went to Beth and her team and said, you know, how long would it take to stand something up like this? And the answer was 48 hours. So in 2 days, Beth and her team put together a soup to nuts project that really basically allows a business owner to say, what do I need to do to safely open my business or expand the business that's been open all this time? You know, how do I look at my bar stools and figure how many do I need? How far apart do they need to be? Help me with which door comes in, which door goes out. Do I need to have one of each? All of these questions are things that you'll hear the governor talk about, and a lot of the stuff is on a bunch of different websites, but we have it all in one place. And you know, as Beth put together this offering, it was like, you know, there's a bunch of stuff that just needs to be free. We just need to have on our website all the resources that you could need, from being able to download a sign that you can print out with your own logo on it to remind people to wear their masks, everything up through providing people that can take the temperatures and then take care of the patient or the employee who shows up with a temperature of 101, and then it's like, oh, well, what am I supposed to do with this guy? Do I just send him home, or is he supposed to be tested? You know, he doesn't have a primary care physician, so what do I do about that? Because normally we'd say, well, call your doctor and do what they tell you. So all of those things were part of the process of putting this together. And we have things that are free, we have things that are, you know, consultations, and then there are things that, you know, when we're providing resources, obviously there's a charge for, and Beth's got all of those things together. So our main goal is to help our community to safely open, so that as we reopen our businesses, we do not overwhelm the capability of our healthcare system. And so far, with the governor's help and moving quickly to canceling the Arnold, for one thing, which, you know, when that happened, nobody knew that right now we'd look back and say that was a stroke of genius. People were like, what are you talking about? This is a big deal for our community, and you're canceling this in the last minute. And turns out that was the right decision. And because of some of the decisions like that, which were difficult, we did not overwhelm our healthcare system. but this thing isn't over. You know, we're seeing a little bit of a lull here. I'm a little concerned with seeing so many people, you know, just sort of taking a deep breath like, well, boy, that was tough, but we made it through. Now we're still in it. We're still in it. The bug is still out there. Until there's a good vaccine, we still need to maintain social distancing and wear those masks. And I like to put forward about the masks is, you know, when you wear a mask, you're not protecting yourself. You're protecting the people around you. So in my view, when I see somebody wearing a mask, to me that says that person cares about me, and I appreciate that, because when you're wearing a cloth mask, it's to stop your breathing and your sneezes and your coughs from getting out there and infecting someone else. Because one of the big terrors of this particular bug is that you can be shedding virus and have no symptoms before you become symptomatic. And some people never become symptomatic, but in that pre-symptomatic time period, you can shed virus and not know that you're doing so. You know, I used to play a little bit of poker, and one of the axioms of poker is there's a fish at every table, and if you don't see one, it's you. It's the same thing with masks. You know, there may be an asymptomatic person in your business that's shedding virus, and it might be you. So I'm really encouraging people to wear the masks. And with that, Beth, did I miss anything, or did you want to ask a couple of those questions that we had in our pocket?
Well, first, let's, does anybody have anything burning that they would like to quiz
sure.
Dr. Windorf with? Okay, so let's start at the very beginning, Dr. Windorf. As an employer, what is it that I should have my employees do before they even show up for work?
Yeah, so the employees should self-evaluate. So they should look at themselves for symptoms. The number one symptom is fever. Almost everyone who has this virus gets a fever. Not everyone, but almost everyone. So fever is most important, but also a cough that's less than like an allergic cough, but a productive cough, you know, excessive sneezing, or just feeling unwell. And then, if possible, take your temperature at home. See what your temperature is. So that's before you go to the office. And if you feel ill, you should not go in. You should call in and then call your doctor to find out what to do next. If you don't have a doctor, as I said, we have resources that can put you in touch with a doctor that can take care of your needs telephonically or with a telemedicine visit to get you what you need. So that's before you go to the office. Then, you know, if you're feeling well, go to the office. There ought to be temperature checks at the door. And then there's probably somebody there who's going to ask you a series of questions about how you've been feeling.
So Dr. Windorf, if I have it set up so at my place of entrance of my meat packing facility, we screen, we run through a symptom check of asking the employees how they feel, if they've been traveling, if they've had a fever, if they've been knowingly in contact with somebody with COVID. And if I take their temperature and it's excessive, let's say it's registering at 101, what's next?
So at that point, the employee needs to be directed to go home and call their physician for further evaluation. And that evaluation will probably include being tested for COVID.
Okay, and I have a...
And when I'm talking about testing, what we're talking about now is swab testing, the test that puts a swab up in your nose and tests for the virus itself. We're not talking about blood testing, which is looking for antibodies to the virus, and that's a test that tells you whether you have been exposed or were infected with COVID.
Okay, and I have a question from the audience. Drinking fountains or water bottle refill stations, do they need to be shut down completely, or should they still be allowed access?
So it's a great question, because hydration is always important, especially in some of the industries where air conditioning is less optimal and you still want to be able to hydrate. So, you know, I wouldn't say you have to shut down bottle refill stations. They ought to be sanitized regularly, and pretty much, you know, what I would do for one of those stations is have a dispenser of wipes right next to the dispenser. Fill your bottle, grab a wipe, and wipe it off when you're done, sort of like you would do at the gym when you finish working with a piece of equipment. Now, drinking fountains are a different story, probably less likely to have the ability to sanitize that well and not feel like, you're putting sanitizer over an area where the water's going to be coming up into your mouth. I would probably shut down water fountains, but keep open water bottle filling stations. And honestly, this is the first time this question's come up, so I'm just sort of talking out loud, thinking out loud. But that would be what I would do knee jerk. Was there a specific instance that somebody had a question about, or is that just a general question?
That was a specific question from Tanny.
Mm-hmm. Did you have any, Tanny, did you have any follow-up, or did they answer your question?
So we have another question from Rhonda Schappert. How concerned should people be about flying? Good question.
It's a great question. So the airlines are doing their very best to make things safe. They're not filling the middle seat. They are trying to limit the number of passengers they take, but I think we've all seen the video of pretty crowded airplanes. At one point it was like they were flying with 10 or 12 people in a whole airplane. That's not the case anymore. And they have sanitized their aircraft. I know there's one airline in Europe that now has you raise your hand before you go to the restroom so that they don't have people standing in line. I think, if you need to travel by air, it's relatively safe, once you get on the flight. And I would still wear a mask. I would still sanitize the area after you sit down, just like many people have been doing for a long time. Try to minimize the amount of contact you have with others. The most important part, I think, is the airport. So, moving through the airport, maintain your social distancing, maintain the mask, and then try, be careful about what you touch. Now, in the last week, there's been a lot of new data about the virus on surfaces not being what we thought it was, not as many people are catching it that way. That doesn't mean we shouldn't be sanitizing. We still need to sanitize surfaces as if you're going to catch it when you touch something. But air travel is right now the airlines are really in a tough place because they want to have as many seats filled as they can to get the revenue because they've been hurting for dollars, but they want to make sure they do that safely. I don't think just not filling those center seats is enough. In my view, they should probably be skipping rows as well. I think some are, but some are not. So it may be airline by airline as well.
Great, thank you. One other question from Sean. What about small offices? Should they be taking temps? And what about for visitors and vendors, for that matter?
Yeah, so here at Mount Carmel, we're temperature checking everyone who comes in the building. For small office, so if you're talking really small, like my old medical practice, we still had 12 people in there. But if you've got a staff of 3, do you need to have somebody specifically temperature checking them? That's probably not a bad idea. But if you're confident that all 3 are going to check their temperatures at home and not come in if the temperature is above what you would expect, then I think I would probably be comfortable doing that. And so that was the first part of your question. What was the other part of your question, Beth?
What about visitors and vendors?
Yeah, so tough one. Customers, are you going to temperature check your customers? I don't think anybody is advocating for that. What people are advocating for is asking your customers to wear a mask and asking your customers to not come into your area, or vendors or visitors if they have symptoms. Now, on the point of visitors, if there's someone coming into the area that doesn't need to be in the area, that's not a customer, not a worker, but a visitor for one of the staff, I would probably discourage that. We certainly are doing that here at our facility. There are no visitors for even patients, patients that are in the hospital, whether they have COVID symptoms or not. We're not letting any visitors in at this point, except for very rare circumstances. I would discourage visitors to your facility.
Great, thank you. We're going to switch gears. Tanny has another great question, and this is regarding testing. If an employee tests or is presumed positive, then everyone in the workplace or just those who had actual contact should be subject to isolation period.
Yeah, so the CDC recommendation is if you've had close contact for a prolonged period of time, then you should be considered a close contact, in which case you should quarantine. Then what that means, the CDC does not clearly define what an extended period of time is. Most people are saying if you were in close within 6 feet for 15 to 20 minutes at a stretch, that you should consider yourself a close contact to someone who has now been diagnosed with COVID. So it's not walking past them in the hallway. It's actually working with them on a project for 15 or 20 minutes. That's probably around the time period that most people are calling an extended time period. So if you're working together, even if you're wearing a mask, remember the masks are not perfect. This does not assume that you're in close contact without a mask. This is within 6 feet, both of you wearing a mask for 20 minutes, and your coworker is now positive for COVID. You should be quarantining at home. 14 days.
Dr. Windorf, can you expand a little bit more about testing? Because I've heard a lot about testing for COVID and then testing for the antibodies. What's the difference, and is there a difference in the testing procedure? And
Yep.
what does that information really tell me?
So the swab tests, the tests that we are doing at the hospitals, they involve getting a sample of secretions from the back of the nose and putting it into a device that actually looks for the virus. So those are the tests that are currently being done, that are currently being recommended. The blood tests look for antibodies, what's called IgM and IgG. And in many cases, in other viruses, what you can do is if you have certain levels of those antibodies, then that implies resistance to infection with the virus or immunity. That is not the case currently with COVID or with this coronavirus, the SARS. So at this point in time, we do not know with certainty that a high level of antibodies provides you immunity to reinfection with this bug. So that's why everyone's being very cautious about advocating use of the blood test for COVID. The additional thing is that the tests that are out there, the blood tests that are out there, are not great in sensitivity and specificity, which means that you could have a blood test that says that you're positive when you're truly not. You could also have a blood test that tells you you're negative when you do have the disease itself. So the false negative and false positive rates for these particular tests are not to the point where without an emergency they would have not have been approved by the FDA at this point in time. However, there is more and more research going on, and we're getting daily updates on that. So 2 weeks ago we were saying don't use them at all. Right now there are some applications for using those tests, and they're getting better as we go on.
Great, thank you. So the flu, Dr. Windorf, pretty much if you get it, you're going to get sick, and that's regardless of how old you are or your health. Can you explain what happens with COVID as far as what is considered a pre-existing condition or somebody whose health is compromised?
Sure. So we've all heard, the governor talking, and they talk about the high risk patient. So when you think of a high-risk patient, you really need to think of it in two different ways. There's high risk of having a bad outcome if you get infected. And then there's high risk of becoming infected. So certain people are more likely to get infected because their immune system is low. So somebody who's had a transplant and is on medications to stop rejection has a low immunity. They're more likely to catch the virus just for catching the virus. When you hear about high-risk patients for COVID, in general, what people are talking about is those patients that they have no more likelihood of catching the disease, but if they do, they have a more likelihood of having a bad outcome. And what they're talking about is age. So above the age of 60, the curve starts to rise, and it really hits its peak in the 70 to 80 year range of people who have bad outcomes from catching the virus. And then there are people who have a bad outcome, again, people who are have a decreased immune system, not only more likely to catch the virus, but also have a worse outcome if they do catch the virus. So, and then it's people with coexisting conditions, especially pulmonary conditions like COPD, but also patients who have uncontrolled diabetes. And interestingly, heart disease, early on, heart disease trumped lung disease in the patients that were having a bad outcome. So known heart disease, that especially if it's uncontrolled, known pulmonary disease, especially if it's uncontrolled, and then diabetes. Those are the big three for chronic diseases that are affected by COVID. And of those three, the top two are heart and lung. And then you look at people who are in both categories. So another cohort there is elderly people in a nursing home. They're more likely to catch it because they live close together, and so they're sharing the air. So they're not only more likely to catch it, but they're more likely to have a bad outcome. And then prisoners are more likely to catch it, but not necessarily have a bad outcome, because most of the prisoners are not in a high-risk category. Beth, still there? I think I saw a chat coming up from Dan. Did we lose
Let's
Beth?
see. I think we may have. This is Sean. I'll read Dan's question.
Okay.
Can you hear me?
Yep.
Okay, great. What action should be taken when you are faced with grocery employees and other food service facilities that are ignoring the requirement for use of face masks? Are there health situations that need to be considered when employees are not able to wear face masks?
So two parts to that question, and I'll take the second part first. Some people cannot wear the face masks safely. Many people with chronic obstructive pulmonary disease or lung disease, they get very short of breath. They're short of breath to start with, and then if you put a cloth mask over their face, it's not a good idea. It doesn't work. The thing is there are other ways that you can mask. So you can use a face shield, a plastic shield that goes over the face. So yeah, it doesn't look very pretty, but it provides the protection that we're asking for. The first part of the question, if I went into a grocery store and the employees there were not wearing masks, I would turn around and find a different grocery store. And I would vote with my feet. There is the option of calling the health department and reporting such an incident, because frankly, the information that came out from Ohio is relatively specific on the mandatory nature of employees wearing a mask. Now, it is not mandated for customers. I would highly recommend to customers that they wear masks. I would ask them to wear masks. I'd put up a sign saying, "Thank you for thinking of me by wearing your mask." Those types of things. I would try to get everybody to wear a mask. But for the employees, if an employee refuses to wear a mask, the business actually has the potential for being cited for that. So if your employee refuses to wear a mask, number one, check and see if they have a medical problem that negates them from wearing it. And number two, if they do, then find an alternative, or discipline the employee. I mean, this is technically a requirement for reopening your business. Did that answer your question, Dan? Okay. I'm going to take silence as affirmation.
Yes, I'm sorry. I'm sorry, it does.
Okay, thanks, Dan.
So switching gears a little bit from those affected directly by COVID, can you tell me what things I should be aware of for my employee, my staffs, and my customers as a result of COVID, as a result of the shelter in place, the result of isolation?
Sure.
What should I be aware of?
So it's a great question, and it's not, so there's several aspects to that question. We realized very early when the shelter in place directive went out, we here at Health Partners, and part of what we do is population health for patients that we are responsible for. We started making outgoing calls almost immediately, especially to a vulnerable population where we knew there was somebody who was home alone, because social isolation makes every disease worse, inevitably. If you have social isolation and another disease, the other disease is worse. It just is. So social isolation has been hitting people fairly hard. So you may have employees who are just feeling bad and need an outreach and need a touch point. The other aspect is now you're asking these employees to come back to work, and you want to make sure that they believe that everything you're doing is going to make them safe when they come back to work, because there is a fear factor here of employees who have been safe at home. They've done all the things they needed to do, and now you're asking them to come back and work, and they're not really sure how safe it's going to be to go out. They've been told for weeks now to stay inside, stay away from other people, but now they're being told it's okay to come back to work. So what you want to do is just make sure you put the things in place that make you comfortable, so you're making your employees comfortable as well. So I think that's the biggest deal is to maintain do what you would believe is best for you and what would make you comfortable coming back to work. And the more you do, I think the more comfortable your employees are going to be. Now, we're not even going to get started on how much they're making on unemployment insurance and whether they want to, come back to work, because now they've been making pretty good money on the unemployment. I heard a whole segment on NPR about that this morning, but that ends at the end of July too. So something's going to change there as well.
So I have a group of employees that have conditions where they go in and see their doctor once every 90 days or so. And they've kind of held off on doing that because they don't feel safe going into a doctor's office or to the hospital.
Sure.
Can you tell me some personal stories from Mount Carmel where that may not have been the best choice? And then give me some advice to share with my employees.
This has been a problem. We early on we saw this in Italy, where the non-COVID death rate started to climb. So patients without COVID, with other diseases, were dying at a higher rate than you would expect. Part of that in Italy was because they overran their healthcare system and there just weren't the facilities available. But the United States is seeing that now as well. The overall death rate is climbing much above the normal, and some of those patients are not infected with COVID. So they're dying from other things because they're not seeing their doctor, because they're not going to the hospital. One of our, Health Partners has a board, and one of our surgeons who sits on our board was telling me that, she's a general surgeon and she's never seen the level of disease of gallbladders that she's taking out up to this point. Because normally somebody will get a gallbladder attack, it hurts, they have abdominal pain, it lasts for 24 hours, they go to the emergency room, they get diagnosed, she can go in with a laparoscope, take that gallbladder out, and send the patient home the next day. Now they're waiting 3, 4, 5 days. That by the time they come in, that gallbladder is gangrenous. It's been, you know, diseased for too long. She has to go with an open procedure. She has to take that gallbladder out. Sometimes there's infection in the peritoneum, the area around the gallbladder, and the patient's in the hospital for 5 or 6 days recovering from what could have been a fairly simple procedure. So we are, we are reaching out to patients who have canceled their appointments. Our medical group is actively reaching out to patients that they think are at risk and providing telemedicine visits or face-to-face visits when it's necessary. But we're asking patients, don't ignore those danger symptoms that you would have called 911 for before. The hospitals are safe. The hospitals have done a great job about cohorting. So they have a floor that's for COVID patients and another floor that's not. So if you don't have COVID and you go into the hospital, the chances are you're not going to be infected there because they're being very careful. The hospitals are actually very safe to go and not catch COVID at this point, as are the emergency rooms. They've gone to great lengths to separate people who may have COVID from patients who most likely do not.
Thank you for that. Dr. Windorf, so you kind of mentioned that age is, we have to be very mindful of our older population regarding COVID. But most of my employees are younger, they're very vibrant, and they have young families. What consideration should I have for the children?
Sure.
Of my employees?
Yeah, and I appreciate you keeping bringing up age every time we're on a call. Thanks a lot. Having just turned 65, hit the big 65, I appreciate that, Beth. But to your question, yeah, so as with many diseases, what you need to do for the young employee needs to be thinking about others. So if the young employee is living with grandma, then you got to be careful about bringing that home. And then you talk about children. Thankfully, this disease does not hit the pediatric population nearly as hard as it hits the non-pediatric population. We've just seen that in every country that it's hit. All the statistics show pediatric cases are low, but we have been seeing a new disorder that looks much like what's called Hashimoto's disease that is in COVID positive children. And there have been several cases in New York City and in New York State. There's a couple of cases in Georgia. I believe there's one case up in Cleveland of children who are COVID positive who have a disease that looks like septic shock. And some of these children have died. So there is an ongoing effort by the CDC to get as much information on this new disease as they can. Many think it's a subset of COVID patients that are catching this disease. But again, the number is low. It's 50 or 60 cases at this point. But the CDC has taken notice, and there are ongoing investigations. So it's not that kids can't catch this disease, and some that catch it can be very severely affected. But in most cases, children have not been highly infected with this disorder.
Thank you for that. Do we have any more questions? Dr. Windorf, do you have any other thoughts? Anything we haven't covered?
No, I just, I appreciate everyone getting on the call. And again, we are here, we're not doing this to make a bunch of money, although Beth loves making lots of money. We're here because we want the community to open safely, because we want everyone to be safe, but also we have a hospital right down the street now from y'all. And we want that hospital to be able to maintain the care for all the people in the community that need it, and not be overwhelmed with extra cases that we didn't have to have if we had just followed some really very simple things. And, those of you who have looked at the influenza pandemic of 1917 and 18, where, fully a third of the world's population died from that. Quite frankly, we're using the same tools to fight COVID that they used in those days. Now, they didn't have antibiotics. They didn't have a lot of the things that we have, but it's social distancing and masking. Those are our big two right now. And until there's a vaccine, we all need to be cognizant of that. And again, I would just tell everyone, when you wear a mask, it's your message to the others that you care about them.
Great, thank you very much. I want to say thank you to everybody that joined us today. And I want to remind you that the purpose of my group is, specifically with the COVID, is to make sure that you have access to all the information possible, but make it very streamlined. It's free information. Go ahead out onto our website. I posted the link in the group chat. I'll email that off to your association, and you feel free to post it in your on your website or in your emails. Part of what we did with that tool set was when Dr. Windorf said to me we needed to set this up, he wanted to make sure that anything that an employer would need in order to reopen, if we didn't do it, we would be able to point you in the direction of a resource that does it and does it very well. So there's a list of vendors there of where you can get hand sanitizer, who it is that can come in and do disinfecting in your building that we already know is FDA approved, organizations that come in and do the ergonomics very specifically to reconstruct a production line if that's needed. That's part of that tool set. The next piece is that I have a staff of 25 people. We are able to come out and sit with you and consult with you to walk through anything that you would need. And then that last piece is if you're an organization that really needs to get up and running quickly and doesn't have the resources to do the screenings or to direct your employees into the testing facilities or to find their primary care physician, we're able to send out a team that could sit at your doorstep and take those screening temperatures and manage that employee through the whole process should they become COVID positive, and manage that 14-day quarantine period if they're asymptomatic. Again, I appreciate your time. I hope everybody had a great Memorial Day weekend and wear those masks.
Thank you, Beth, and thank you, Doctor. That is just a great bunch of information, and it was presented well, and I sincerely appreciate it. I think that we may send out the resource pack that you've been talking about, maybe even to all of our members, just as a resource for them if they can use it. This will also be, as I said, on our social media pages, our website, and our YouTube page. For people to come back and watch at their convenience. So thank you so very much. I hope that everyone has a wonderful and safe day and the rest of their week. And thank you both, Dr. and Beth, for your time this morning very much.
Thank you, Sean. Sean, we have one question that snuck in under the line, and Dr. Windorf, I'm going to put you on the spot. Could you please let us know approximately how many cases of the virus have been treated at Grove City and maybe the bed use that's going on right now?
At Grove City, it's been in the teens to 20s. Let me see if I can. Do I have a minute to just pull up some information here?
Sure.
Let me see.
Dan, great question.
Yeah, let me see what I can find here from over the weekend.
I didn't mean to put you on the spot at the last minute, but
no
problem.
I like it when people put them on the spot. It happens infrequently.
It's a good question. Okay, so Mount Carmel, Grove City. Currently has 11 cases in the hospital, and that's what they've been running throughout this time period in the high single to low double digit numbers. The total number treated, I don't think I have that information. No, I don't have the up to date, but that's Grove City. Of our 3 hospitals, Grove City has actually had the least number of cases routinely. So they're running about 10 at a time. I'm going to guess probably a maximum of 30 for the overall period here.
great, thank you.
Yep.
Dan, were you expecting a higher number?
be quite honest, yeah, I was expecting probably more than that.
So just to be clear, the only patients being admitted are really sick patients. There have been many more that have been tested and found positive in the emergency room and sent home with home care. So probably double that number or maybe more have been tested, found positive, and sent home to care at home. Only the sickest patients were put in the hospital. You know, just as an example, of the patients that are in the hospital now, 2/3 of those are in the ICU, and most of those are on ventilators. So they're only admitting the sickest patients with COVID. If the patient can be cared for at home, that's what's happening.
What are the chances of a false negative?
For the swab test, the false
Yes.
negative is almost zero. There's no such thing as a perfect test. But with the swab test, the false negative is almost zero. The tests are specifically designed so that you don't miss a positive. So they'll accept somebody being designated as positive who is truly negative. They're, you know, anytime you have a low false positive rate, you have a higher false negative rate. So that those two sort of go against each other. So the swab test they're using now is almost 100% sensitive, which means if you have the bug, it's going to tell you you have the bug.
Mm.
Did that not make sense?
Yep.
Yes, that did make sense. Yes, absolutely.
Yes, it made sense to me.
Good.
Thank you again for all your time.
Sure. Pleasure.
All right.
Well, Beth and Dr. Wendorf, again, thank you so very much for your time. And we do hope that everybody has a great rest of your day and a great week. Stay safe, be smart, and be kind.
Thank you very much. Bye.
Bye.
Thank
you.
you.
Bye.
Bye, everybody.